Thank you very much. Well, yes, thank you everyone for coming and joining us at this webinar on the intersections of domestic violence and harm reduction, hosted by us here at NASTAD, and thanks to the generosity of the Opioid Response Network. Today, Alika and I will be hosting this webinar. I'll let her give a quick introduction of herself. If you want to give us a quick little who you are.
Thanks, Juan. Hi, everyone. My name is Egwuatu. I'm a senior associate on the Drug User Health team at NASTAD, and I'm based in DC. And lovely to be here and excited to have this conversation today.
Awesome. And my name is Juan Tirado. Pronouns they, them. I'm also a senior associate at the Drug User Health team at NASTAD, also based in DC, and excited to see what our wonderful panelists will have to share with all of you today. Next slide, please. So just a quick little 411 on what we're doing today. We'll be exploring the interconnections between harm reduction and health services for people experiencing domestic violence. Our wonderful group of panelists who come from a variety of backgrounds, whether it be domestic violence or harm reduction or both. We have Chibundo Egwuatu, we have Ariel Johnson, we have Lisa Pous, and we have Heather Edney. They will be introducing themselves and telling us a little bit more about themselves as they participate in the webinar itself. I think we can go ahead and move on, and I'll pass it on to Alika.
And then just wanted to quickly add here just some like housekeeping and logistics. So yes, as Juan mentioned, we're recording this right now. We'll send out the slides after. And also we've toggled closed captioning, so you should be able to use that if that would be helpful. And this is a large Zoom room, so I believe we have folks muted, but we'll be keeping an eye out just in case. And we'll have Q&A at the end of this webinar, and we'll hopefully be able to get any questions answered. Juan and I for anything that comes through.
Yeah, and we want to make sure you all get what you want out of this webinar. You have here in front of you, like I said, a group of amazing panelists. So be sure to ask the questions that you want them to answer for you. Yeah, take advantage of having such a great group of people all at once in one place.
Okay. So just as a quick little overview about NASTAD, we are a nonprofit organization that represents public health officials who administer HIV and hepatitis programs. We provide services throughout the US as well as DC, Puerto Rico, Virgin Islands. And our mission is just to end the world of intersecting epidemics of HIV, viral hepatitis, and related conditions by strengthening domestic and global governmental public health through advocacy, capacity building, and social justice. And our vision is to have a world free of HIV and viral hepatitis. And then this webinar is also presented with ORN, the Opioid Response Network, is SAMHSA funded, and they assist states, organizations, and individuals by providing the resources and TA needed to locally address the opioid crisis and stimulant use. Technical assistance is available to support evidence-based prevention, treatment, and recovery of opioid use disorders and stimulant use disorders. And then also ORN provides local experienced consultants in prevention, harm reduction, treatment, and recovery to communities and organizations to help address the opioid crisis and stimulant use. ORN accepts requests, and later in the presentation, we'll provide a link that folks are able to use to request any TA and also reach out to either Juan and I or the Drug User Health team to request TA from us. And each state and territory has a designated team who is an expert in implementing evidence-based practices. So just an opportunity and an avenue to provide TA. And then we just wanted to start off because we know that we're discussing people who experience domestic violence, people who use drugs, and wanted to share a discomfort agreement. We know that this isn't going to be comfortable, and examining how exactly we sit with our feelings is really important just for this conversation as a whole. So in addressing shame, just for example, thinking about the ways that we and society have treated people who use drugs and survivors in the past. And that should not stop you from doing better in the future through reflection. And acknowledging the ways that you've done harm and develop ways to fix it, not perpetuate harm, and not do it in the future. And then also with the discomfort agreement, agreeing to take care of yourself in whatever way that works best for you in this webinar itself. Feel free to step away if you need, take a sip of water, log off, whatever you need. Good. And so we wanted to provide an overview of what exactly is harm reduction and provide a quick little information on the intersections of DV work and harm reduction. We know that folks here who may be attending may have a background, may not have a background. So just placing this for some level setting. But harm reduction is a set of practical public health strategies designed to reduce the negative consequences of drug use and promote healthy individuals and communities. It is also, and first and foremost, a movement for social justice built on the belief in and respect for the rights of people who use drugs. So built by people who use drugs for people who use drugs in order to have the rights for people who use drugs, the right to services, and really the right to exist in the world. We also wanted to just point out some harm reduction principles, as well as some other points that harm reduction can be. Harm reduction in itself is low barrier, low threshold, and non-judgmental services that are designed to meet people exactly where they are. And they are the most common entry point to engage in highly stigmatized, hard to reach populations, such as people who use drugs and people who inject drugs. It serves as an alternative to abstinence-based recovery programs, and it recognizes the whole person behind a person who uses drugs, so the health and dignity of an individual who uses drugs. Other principles include being participant-centered and participant involvement, so ensuring that folks are incorporated at all steps of developing a program or developing a policy statement or offering services, that it is informed and centered. Noticing participant autonomy, so that people have autonomy to do what works right for themselves, and it is like how it works for within themselves. The cultural complexity to recognize the really the social and the cultural environment that exists for a person who uses drugs, and then also just being realistic about changes that occur and how people engage within their drug use. So cannot save people, cannot do things like that. It is that participant autonomy that people have control over their own bodies. And then what does harm reduction look like in practice? So a provision of services to people who are actively using drugs without the expectation that they stop using drugs. It's non-judgmental, non-stigmatizing engagement of people who use drugs, and acknowledgement of the harms associated with drug use while presenting accurate and complete information about ways to reduce those harms as much as possible. And then just to kind of tie it together pretty quickly, domestic violence and drug use. Domestic violence and interpersonal violence exposure in women may increase the occurrence of risky substance use behaviors, such as unprotected sex and IV drug use, leading to increased rates of HIV and HCV. Drug use itself is not inherently a tool for abuse, as it is a social activity, but it is a lever that an abuser could pull to exert control. And another important point is that abusers can be the provider of drugs. It's important to educate people to become less independent, or to become independent on their drug use, less dependent on their abusers as a harm reduction practice. Yeah, with that, I'll pass it over to Juan.
Yeah, so just to go over just a couple quick examples or more concrete examples on how domestic violence and harm reduction can overlap. This first article from the New York Times talks about which, from the people who are here on the domestic violence side of things, I'm sure you're very familiar of the harm that it can cause when the person who is the victim of the abuse now has to receive surprise visitations, mandatory searches of their residence just because they were a victim of abuse. Like there is no reason that to suspect that they are abusing their child. It's just often the logic that's used is like, oh, but they might go back to their abuser, et cetera, et cetera. None of those things are enough to constitute like illegal searches of their residences, but they still happen. They still cause trauma and increase the trauma of the people who are being abused. And the same happens with people who use drugs. And if people who use drugs are in this situation, it just compounds. It means that the next time they do that search, even though they may not be using drugs around their kids, or they may not be using drugs in a way that harms their kids, now not only are they a victim of abuse, but now they are having their children taken away. And that harms the children, it harms the victim of the abuse, and doesn't help anyone in that situation. Another example is how we may or may not be considering gender-based violence or domestic violence when conceptualizing spaces like safer consumption sites. Like they're an amazing form of harm reduction, but if we're not addressing the gender-based violence or the domestic violence that comes into those places, um, you might be perpetuating harm. But like I think Marissa just said in the chat, they can also be like a great hub for those resources. As if you're having those conversations, if you have your staff with the correct training, instead of being a place where we're not taking that into consideration and maybe putting people in danger, it could be a place that actually increases the access to resources for people seeking out both harm reduction and DV resources. Um, yeah, but just wanted to share some of these examples. Once we share the recording with the webinar, we'll also share the slides, and you'll have the link to the New York Times article as well as the national survey report for women and gender inclusive overdose prevention, which if I'm not mistaken, is in Canada. But yeah, it was cool to read through, and they have way more information than what I mentioned, but felt like a good way to kind of point specifically at how these two worlds can overlap. And now for the part that's the most exciting of the whole webinar, which is to hear from our actual panelists.
Hi, my name's Ariel Johnson. I'm the Director of Operations for Virginia Harm Reduction's West Piedmont office. That's our more rural space, which covers Martinsville, Henry County, Patrick County, Franklin County, Virginia. My hope is my secretary won't chime in while I'm talking to you guys about what I do in Southwest Virginia. But we also serve Roanoke City. To give some insight, I've volunteered with Virginia Harm Reduction Coalition since right at end of 2018, but actually got my first paid position with Virginia Harm Reduction in 2019, thanks to a patient navigation grant that was passed through by NASTAD into our organization. And originally, that grant, our focus was HIV, Hep C, linking folks to treatment. And unfortunately, thanks to COVID, our health department decided that that had to get put on the back burner while they figured out what to do about COVID. And what I quickly identified working within Virginia Harm Reduction and was that there was so much more that we could and should be doing for the participants that we serve outside of just the SSP operations we were doing. Which that's a very important piece, but there was more that we could be doing specifically in the realm of patient navigation. I think patient navigation could be a very expansive definition. And prior to going to Virginia Harm Reduction Coalition, I was working within a domestic violence agency called Southside Survivor Response Center. And being able to kind of pull some of that past work I had done into my work as a patient navigator, or back then I was the drug user resource care coordinator with Virginia Harm Reduction Coalition. What I quickly identified was there was a huge overlap in domestic violence and harm reduction, right? So we ended up currently we serve 1,400 participants within Martinsville, Henry County, Patrick County, Franklin County, and Roanoke City. Within those 1,400 participants, 606 of our participants identify as individuals who are survivors of domestic violence. And that was something that was very evident to me within the first year of me working with VHRC. So one of the things that I started to look out for was domestic violence, because I like grants or ways that we could start integrating more support for the individuals we were serving, because most of the agencies in our community would try to exclude people who are using substances from the program. They kept constantly trying to tell them, hey, like, I see that you're struggling with domestic violence, but you really need to go through detox first. Basically, like, worry about your drug use before you worry about your safety, is how it seemed to me. And also, like, that constant re-victimization of my participants when we're calling and doing these assessments with domestic violence programs. And I got fed up, so we ended up writing a grant. We had a grant after the first year of working with VHRC specifically for us to build out a domestic violence program within our SSP. And since then, we've been able to serve 43 people within the last 3 years, which isn't a lot. However, like most people that work within SSPs, realize that we could always use more staff. And luckily, we just recently hired, thanks to the grant continuing and always expanding a little bit more, we just hired a full-time domestic violence case manager. So I'm excited to see the progress we'll be able to do moving forward. But since having the domestic violence program, we've served 43 people that are actively using substances. We've provided 371 nights of shelter for those individuals that were fleeing domestic violence. Those were individuals that were in a crisis situation, and we were reached out to other programs. They were denied, so we were able to link them to, we do our programming through hotels. So we were able to separate them into a safe space. We always put it under an anonymous name so that if somebody calls the hotel, they don't know where they're at. We always give them information to the Never Use Alone line, because it's really important that they're, in the time that we're separating them from these supports that they often have linked to the abuser, that they have supports to help them in regards to safe use, while we're trying to help build stability for that person while they regain independence. Because our biggest thing was trying to be as trauma centered while also focusing. One thing that we notice within domestic violence agencies is that they oftentimes claim to be trauma centered, but oftentimes made our participants feel as if they were being judged or prosecuted for being somebody who uses substances. And then within that, we've had 572 encounters with our participants. I'm also the director of a local warming shelter, and I've worked pretty closely with our housing coalition to try to identify more opportunities to be more inclusive of people who use substances while providing housing opportunities within our communities. And I'm excited to be here. I'm excited this is a conversation. As long as I've been in the harm reduction space, this is something that I've always found was really important. We just don't talk about enough.
Thank you, Ariel. I think we're gonna pass it on to Heather and go through the slides.
I thought I was last, but I'm super excited to be doing it now. Hi, everybody. My name is Heather Edney. And okay, so I co-founded a syringe service program in the late 80s, early 90s. So I'm going to be talking about the olden days right now, first wave harm reduction. What's so amazing and depressing is that everything that was true then is true now. But I'm so excited that NASTAD is hosting this today and bringing the DV community and the harm reduction community together, because we absolutely need each other in order to be more effective. And I'm super honored to be on this panel with the other speakers. Okay, so I'm going to talk about just like what a scrappy SSP by and for users did to just address some issues that were taking us down. Next slide, please. Okay, so when again, remember the olden days, no internet, or like internet was just becoming a thing. There was just no information. The information that was there was geared towards men. It was for men. And there was this one iconic booklet, Does Your Man Shoot Dope? But that wasn't like for women. It was like for women as it related to their man. So we were annoyed, and also just not annoyed. I'm sorry, I wasn't expecting to go next, so I'm like a little off. So we needed information. We needed information on how to use drugs safely. So next slide, please. So we started to create our own educational material that centered women and used women, or used like the icons of women, or was just specifically for women. But also there was no information on safer drug use anyway. So I would like to think that everybody benefited from it, but it's just, that was how we got started. Next slide, please. So let's see. Hold on really quick. Basically, yeah, I'm sorry. So basically we just, we started to create zines. Zines were how people communicated, who were like, like the underground communities. I'm just trying to, it's weird because I'm trying to explain like what we did in response to like not having access to information, but I also feel like like explaining like this historical thing about how people communicated who did not have access to like anything online. So it is a little, I do feel a little like scholarly right now, which I don't mean to, but like whatever. Next slide, please. This is what we did. So we had this phenomenal group of women providing services to women and men who use drugs. We were all, this was pre everything, health departments and other social service agencies getting involved. So we were underground, illegal, unfunded, accountable to no one except to the people that we served. And so, and we were hustlers. So we would raise money, and we ended up being able to open a drop-in center. Then we opened a second drop-in center, and created things like, we called it Junkie Salve or Vein Vanity, like vein care cream. We did all these really amazing things. Next slide, please. But I think one of the things as it relates to today that was important is that we taught each other how to shoot up, because one thing that we were noticing was that and experiencing in our own lives is that a lot of times women do not, a lot of times the person with less power in the relationship doesn't know how to shoot up in the beginning, and they are relying on the other person for them to get well. And so we did this campaign, Smack Back Girls Teach Girls How to Fix. It was in a zine called True Stories by Girl Junkies. And next slide, please. NHRC went on to use some of these images for their various publications. I included like the actual photographs next to what was in the zine. The zines are the one with the X's. because I want you to see just kind of like the humanity of it. The reason we put X's on our faces is because of like stigma. Still a thing, sadly. Next slide, please. Yeah, so this is all just like very basic information. There's a lot more nuance to injecting, but hopefully it was our hope then that it would at least kick off a conversation. Hey, I saw this thing in the zine, you're at the site, and like you start talking about it. It's like just a way to start talking about it. And it's a way to start talking about the way that, you know, women were compromised by their partners to do shit they did not want to do, you know, in order to survive. Next slide, please. Let's see. I think I'm gonna wrap up. I mean, this is just, you know, like one little snapshot of one little thing that we did. It might seem like a small thing, but like, trust me when I say it's a huge thing if you're strung out. And so we did these little micro targeted campaigns around all different aspects of like health. And yeah, and like people are still using them today. So I guess my point is like, if you have a small idea, like just do it, try everything, because you never know what's going to work. And with that, I will end. Thank you.
Thank you so much, Heather and Ariel. And we have a few questions for our panelists that we want to ask, but we also encourage everyone in the audience to put questions either in the chat or in the Q&A, and we will ask them of the panel as well. But before we begin to the panel, would love to hear from Chibundo and Lisa some quick introductions.
We're making faces. Is it you? Is it me? We're doing the politeness dance. Thank you so much. I am Lisa Pous. My pronouns are she, her, they, them. I am the Peer Support Program Director at the Safe Alliance in Austin, Texas. And a lot of you may know the term peer support. It really is just a fancy word for another survivor working in this field. And so Safe Alliance is one of the leading national models of domestic violence, interpersonal violence, sexual assault, human trafficking, survivor-centered services. I like to call us the Cadillac of waitlist. And it's not because we're not good at what we do. We have a lot, and we have a lot of amazing services. The challenges are really common, and you know them. It's just still not enough. And so there's still always a wait list, no matter how many good things we have. I came through our services at SAFE many, many years ago. And I'm so glad when I met Heather, she reminded me of things. She reminded me of who I am, for one thing, and took me back to my roots and my self-love just by talking about her program. But also she reminded me that when I hit the SAFE shelter, a woman came to my room with a needle sticking out of her arm. And I didn't know what to do. Neither of us knew what to do. And what she did was go back out into violence every day and then come back to shelter. And I don't think that that should be an ongoing issue. It's been almost 20 years since I was in shelter, and it's still a problem. It is really past time for us to unite, lean on each other, and learn from each other. We created a program. So I really like SAFE services. They are a harm reduction model. I was a challenging client, just a little bit. I even set the shelter on fire once by accident. Like, when I say challenging, I'm the kind of person that you screen out of programs, and always had been until I came to SAFE. And they had switched to a voluntary model, a more harm reduction model, and it is the only reason I believe that I'm alive today. Because they didn't kick me out when I set the shelter on fire. They didn't kick me out when they found my drugs in somebody else's apartment. They didn't kick me out when they found alcohol buried in 3 suitcases in my closet during monthly inspections. And we kept working and working and working together. And I would like to continue to improve the services we have at SAFE. We have the same challenge that everyone else has, staff turnover, and we're starting at 101 with so many people all the time that our ongoing relationship is direly important. People are not having the lives of their own choosing free from violence because we are not friends, because all of us in harm reduction and domestic violence are not interconnected as to be one. When I hear the numbers from Ariel, I'm astounded. I am astounded. And yet it's things I knew, right? Like it's knowledge I know, but then Ariel helps me apply it. And I think that that's what we can do together is learn and help each other to be kinder, more compassionate, more strength-based, more understanding. And especially if we're going to be working with housing first models, because it's literally a requirement of the law. And if anyone doesn't like it, then the answer is give the money back. Let somebody else who wants to do housing first, person-centered services, have the money. I would like us to be friends and to grow together, but anybody who doesn't want to grow is literally standing in the way at this point. When I hear the numbers, so what we created was peer support services. We have about 14 groups a week. We have about approximately 500 participations a month. So, and that is not 500 people, like that's real sexy to me, but it's 500 participations. And a few of our people come to all of the groups. We have groups for harm reduction. We have groups for only Black people that I would not enter, even though I'm the director. We don't want to put barriers in the way of people. I don't say what people do in that group. They tell me what to do. Lisa, we need food. Lisa, we need a bigger room. And I am the helper. Do you need me to help clean up? Do you need me to order this? What can I do? Same thing for our Latinx services. So we also have services in Spanish. We serve domestic violence, sexual assault, human trafficking survivors, of which I am all three. Everyone on my team has lived experience, and we all are very passionate about personal choice and autonomy, not just harm reduction, but living the life that you choose to live and loving you exactly where we're at and where we meet people. And so I'm really grateful to be here today. I am so honored, and I'm thankful to you for taking time in your really busy schedules, because I know you're direct care providers, and that means you work too much. So I am really grateful that you took the time today to come learn and hang out and build relationships with us, because community care is where it's at. Like one person is not enough. We need each other. And I just really appreciate you. Chibundo?
Hello, everybody. My name is Chibundo Egwuatu. I have a background, well, I guess I came to this space starting from abolitionist work, really, in sex worker organizing. And I was in grad school doing a doctorate thing, and I came to DC, where I'm currently based here. So I worked at a harm reduction agency called HIPS, where I was working on the sex work decrim campaign and the drug decrim campaign, drug possession decrim campaign. And then spent the last few months at the DC Coalition Against Domestic Violence. So I too am really excited this is happening. I was chatting with Juan, like, I guess around this time last year, maybe a little like sooner to this time, about this conversation. I got into DV from harm reduction because a lot of the services that I felt like people needed at the harm reduction space I was in, like good housing. Like there's not a lot of, harm reduction programs that can be doing the housing things for a lot of really weird, silly, stigmatizing reasons. Or things like flex funding, where it's like, yo, I'm working with programs where you have some survivors who are getting $500 a month with no strings attached. That could change a lot of the clients at a lot of these SSPs' lives, like forever. Or you have a program that has 2 years of housing with not very many strings attached. And I'm like, wow. If I got, like, because we have so many people in harm reduction who are survivors of violence. And also being in DC, it's still a pretty Black city. It's a lot less Black than it used to be, but a lot of the clients we would have at HIPS were Black, and specifically Black trans women. So it was one of the first places, only places I've ever worked at that had such amazing Black trans leadership, people with lived experience being on staff. My boss there, I would say she's my mentor. I've never said that to her, and now it's going to be recorded, so I should probably say that to her soon, so this isn't weird when she sees this later. But my mentor, Tamika Spellman, hired me there. I worked with her when I was interning there in 2019. And she's amazing. She has lived experience in all these things. She started out working in organizing with unhoused people in the shelter as a Black trans woman, saying, hey, we're facing a lot of violence in this shelter, and the homelessness system in DC does not care about our specific needs. So she immediately always came from to these discussions about human services from a racial justice space, a gender justice space. And I'm really grateful that my tenure in this space was definitely developed along those lines too. So this stuff about domestic violence, where I'm working with sex workers specifically, and so many of them have both experienced domestic violence, but are feeling like, you know, to what Lisa was saying, the person you screen out, right? They are the people that you screen out of your DV space. But also in harm reduction spaces, not necessarily feeling safe at local SSPs, especially if you're known as a sex worker and you're Black and trans at an SSP, you could get into a lot of interesting situations. And to both what Heather and Ariel said, a lot of them might still be getting their drugs through a man, usually a cis man in their lives. I was just at the little SAMHSA thing that's happening today and tomorrow. Someone just did a really amazing presentation. Jennifer Carroll did this presentation on her research, looking at how just the change of your source of your drugs can be a huge indicator that you might have an overdose very soon, because you don't know what's in the drugs, you don't know this person, you don't have a relationship. So I think also with these DV programs being like, you have to be sober basically in order to escape violence, they're asking you to choose between your safety and between, you know, your health, really, as like all the panelists have been mentioning. But also, if you get out of that system and you're away from your the person who's been abusing you, who's your next hookup? How are you going to get to your next hookup in a way that's going to be safe, in a way that, like, especially in a space without widespread drug testing and without safe supply, how are you going to make sure you're not going to OD? I love that also. I believe Ariel brought up, or was it Ariel, Heather? I forgot. Someone brought up the never use alone line. So like that, if anyone leaves here with nothing else but just that line, to make sure that if you're in a DV program and you send that out, please send that out. That is the number one role of any harm reductionist, anything. You don't need money for that necessarily. You just need somebody who cares. But okay, this is supposed to be just my introduction. I'm going to stop talking. Oh, yeah. I'll find the link. Sorry, someone in the chat just asked for the article around increased risk of OD with a new source. So I'll find that. I'll put it in the chat. I actually don't know if it's published. So I will definitely look for it. I don't know what the last line was. I was just saying that, like, this is just supposed to be my introduction, and we're going to questions and answers. So I'm going to actually make sure we could do some Q&A later on and get through the questions for the panel. But that's who I am. I can put my email in the chat and everything. I'm really happy to be here, and I'll keep chatting.
Thank you so much, Chibundo and Lisa. I have some questions I want to start with, but again, please let us know if there are any questions from participants, and we will collect them and work them into the questions we'll be asking the panel. But even though we've kind of touched on this already, just as a chance to get everyone to talk a little bit about it, and if there's anything you'd like to add, is why should harm reduction and domestic violence be on the same continuum of care? And what could that look like, and why is it important?
No, go ahead.
I was just gonna say, it already is, like, it's just happening together all the time, like always. So how to like make those intra-organizational referrals, it's like just it's just about doing it. But I don't know. Somebody else should answer this question, because I'm like getting too meta about it. But
I literally was going to say the same thing, though. Like, it's happening regardless together. I think we have a lot to learn from both. But like, we have lots to learn from interpartner violence experts as much as they have to learn about us as harm reductionists. So
yeah, I think it's already happening, and shelters should be in a harm reduction model anyway. We should not be telling people just leave. just get out. You don't stay there. Leave tonight, no matter what. A, we don't have any housing. We have wait lists. We don't have immediate shelter for most people. So we're not going to say just leave, and we should not say just quit. Just don't do that. Just don't be yourself. But on a personal level, I would also tell you that the drugs helped me heal. Like, I needed that. I couldn't take off the masks to talk about the trauma without being high at first. It was my only coping skill, all I had. And without it, I don't think I'd have made it. Like, I needed to be able to talk about that stuff, and I couldn't. And over time, I built more coping skills, and I didn't need to escape me as often or in the same ways just to talk about what happened to me or show up for myself. And my usage changed. And without those opportunities, who knows what people get those chances. So I think that we're already, like, it's already that we're so entwined, intersected as to be entwined. It is one when we look at the numbers. It's more than 50% of the people, about 70% of people that experience violence that are using drugs, and about 70% of the people who are using drugs that experience violence. We're so intersected that we are one. Out there to any individual that's experiencing it is definitely one thing. And for us to divide that for them is a crime.
Oh, sorry.
Oh, no, go.
Okay, yeah, everyone said something amazing. It's just because I know in DV, at least a lot, we always say there's no wrong door, but there's obviously a wrong door if you're not the right type of, well, victim, the perfect victim narrative. If you don't work into that, then every door is the wrong door. And the beautiful thing about harm reduction spaces, at least in my experience, and I've been blessed, I will say, is that we are the wrong door. Like, if you don't have a right door anywhere else, you could go to a harm reduction agency. If you're like, I don't want any services, I don't want to change anything, someone might just sit with you. Someone might just go outside and have a cigarette with you. And sometimes that's all you really fucking need. You just need someone to be there, and I was doing policy work at both of these spaces. But I will say that when I was doing policy work and harm reduction, I was still in the drop-in. I was still on the overnight van. I was still doing street outreach, and sitting with people and talking to people. So that lovely little feedback loop of you're on the ground and you're actually talking to the lawmakers and everything. I think it was just fabulous. It was beautiful. You didn't necessarily have to wait for the research project to come out, or you were part of the research project. So you just were on everything. But as we keep saying before, sometimes SSPs can be a very masculine space. Even if you have a lot of women, cis or trans, of any experience running the space, really, you're doing all the labor in the space, there's still patriarchy. Who knew? Harm reduction did not end patriarchy, but it still exists, And I will say that's the one thing that DV spaces do very well, is constantly trying their best to confront patriarchy. Well, I'm giving them too much credit, but confronting maybe masculinized spaces to sometimes not great outcomes. But the thing is, both sides have a lot to learn from each other. If you're a survivor going to an SSP, you should be safe and happy and healthy there. Having even your access to harm reduction supplies also be, metered by someone who might be in community with the person abusing you is really problematic. And that happens a lot at SSPs, even for not just for the clients, including the staff, including the staff. We all have stories about that, about staff having really horrible DV situations that the SSP has no response to, really. And that abuse just kind of runs rampant there. Oh, SSP means syringe service program, but any harm reduction space. And same thing with DV. If you just get kicked out as if you use at all, you sometimes in some DV organizations, you can't even say that you survived domestic violence, or they don't hire survivors, So there's this huge just gap between lived experience and work, or lived and living experience and working in DV spaces. So a lot of the cultural things, there's a lot of cultural things that each side can learn from each other, is what I'm going to say there. And of course, for the people who are the clients, because the clients need both services, I should be able to go to a DV advocate and they give me access to the harm reduction resources in town. They should tell me about these things. They should say, if you need works, this is where you go to do it. Even if legally they cannot actually help me with that, because of course there's a lot of laws about what they're allowed to say and do, they should know who can. I think that's one thing that DV can really learn is if you're not that one, if you aren't the one, know who the one is. Send those people to those people. You got to know that. It's irresponsible not to. But I'm rambling again, so I'm gonna stop.
I wanted to quickly say that if you're not like the shot caller at your organization, hopefully like NASTAD will continue this conversation so that until like system-wide change can be made and shelters will accept people who use drugs, like I'm not going to hold my breath for that, because like for all the reasons, like there's little micro things we can all be doing to address this, like, you know, kind of on the DL, and then the system-wide changes can happen. But I'm optimistic that NASTAD has embraced this issue and, you know, have some kind of ongoing conversation about it. The other thing I wanted to say really quick for like about harm reduction programs is like, it's cool to close the doors and have women's only hours. We did that. We actually made our male volunteers quit for a while because we were like, you guys are so intense. And so they did, they left. We got things tight and made it like very safe feeling, and then they came back, and men got services the whole time, but we needed to like carve out space, and that was like pretty phenomenal.
Thanks, y'all. I have a few questions from the chat for specific panelists. For Chibundo, one question that came in regarding what you were saying a little bit earlier about serving Black trans women, specifically at HIPS, is why do you think that Black trans women specifically have issues at SSPs? And what have you or anybody else observed that made it difficult for those individuals? And what can we do? What can people who serve Black trans women specifically, or other oppressed identities, to make sure that they receive the services that they need?
Yeah, thank you for that question. Well, I'll say some of the things that went well, and then I could get into like why. Well, let's just say it's obvious, right? In some ways, like transphobia exists. You're going to have clients that come to the SSP who are transphobic, even if you have trans staff, maybe especially if you have trans staff, because they're like, oh, you can't do anything. You have to serve me. I finally have a captive audience to let out this thing inside of me at you, this hate I got against your people. And it's just, it's constant, it's consistent and constant. Transphobia, especially like, is there like trans misogynoir? Is that the term I would use? Like hatred against Black women who are trans specifically, is extensive. I definitely think when it comes to intersections of like intersectionality and thinking about like who really receives a lot of violence in all these spaces, it is Black trans women, and Black trans women tend to also not be allowed or catered to or made space for in a lot of DV or harm reduction programs. Unless, like in a place like I was at and I was grateful to be at, you have Black trans people on staff. So that was really, really helpful to have Black trans women in staff. And my boss was a manager there. So like right underneath the executive like suite. So that was very helpful. She was always making sure that if a space, there was something in a space that was obviously exclusionary. Is that is exclusion? Okay. Exclusionary towards Black trans women. She's just like, she sees it immediately. So like, you don't have to do as much guesswork or as much research if you just actually have the people there, like at the table. Give them a job, give them wages, give them a living wage so that they are comfortably housed. They want this place to work. And my boss was a client at the place that I was working at. So she was a client from Jump and worked her way up to being a manager there, and in charge of the sex work decrim campaign and our participation in our drug possession decrim campaign here in DC. So I'm like, if you have an SSP that is actually having that space open to the whatever demographic that you think is most marginalized in the space you're in, that's not going to be Black trans women in every city or every location. If you're in a rural area, if you're on a reservation, of course. But like thinking about who is the folks in the community who are like least catered to, how do we make sure they get into positions of like power, not just like work, not just labor, but power, not just making them do more things, but actually getting them in a position of power where they can be at peace, feel comfortable saying what's wrong in a space, and knowing that you would actually respond to it. I think that's really, really important. Other than that, especially in the sex worker organizing space, we spent a lot of time fundraising. Like when I was in charge of the SWAC, we did a lot of fundraising, got us to 6 figures finally for the sex worker project. And I was like, now it's time for a Black trans woman to be in this job where now that this job can pay her a living wage. Before it could pay a living wage, where I was just like, okay, let's work on grant writing and fundraising and all these people here who are not part of the community. That's going to be our jobs for now. It's like, how do we make sure that these people can be in this job while also being housed, while also being healthy, rather than constantly giving more and more and more? Because there's also the, I don't want to be I don't want to sound too like aggressive or offensive or make anyone feel something, but this can be something that people feel things about. I do think in the do-gooder space, sometimes we take advantage of the fact that people have had lived experience and they care. So the fact that they care means that they'll do more. They're going to put in those 90 hours and only clock in for 40 or 30. You know, they're going to give people their personal phone number and you'll have clients calling them all the time. They're going to use their own cars. They're going to use their own gas. They're going to use their own money for things. And sometimes when I've witnessed some organizations really kind of rely on that. The fact that the people who are like really, really experience these things and this is their community, how much they're willing to sacrifice and kind of make that part of their bottom line. So I think that is the best thing you could do is like, of course, give them a living wage, make sure they're happy and healthy there and are comfortable saying something that you actually do something about the things they say, but also not taking advantage of the fact that they give a shit and they would probably do this for free if they had one single breath left in them, they would use that breath to like give somebody some supplies or to like get somebody a house, you know. But thank you for that question.
Thank you, Chibundo. And now we have one for Ariel. So how or what did you start looking for when integrating a DV shelter into an existing SSP program? And what is some advice or observations of barriers to tackle early in that process?
I think the biggest thing that I did when we were starting to look into this was recognizing that we had very limited capacity and the funding that we got was very limited as well. And one of the things that I wish I would have thought about earlier on when we were building out this program, because like thinking about the do-gooders, right? Like I am definitely one of those individuals that has done this work for free, will tomorrow if everything becomes illegal again and all of our funding is stripped away. Because at the end of the day, I think that this is truly like my folks deserve this. But the biggest thing that I wish I would have recognized is that unfortunately, because there's such limited capacity, that there were going to be times where I was going to have to prioritize like where they were at in regards to their safety. Is there somewhere else that they could go for tonight that they'll be okay till tomorrow so I can get this person who's really not safe into a hotel? Playing that, to me, it feels like a juror, unfortunately. And I don't even like that term. I'm not a huge fan of the criminal justice system, but it's very much like feeling like I'm judging, like, does this person deserve this hotel for tonight or does this person? And I wish early on that I would have come up with a way that kind of took that, like it was more built off of an assessment or something and took it out of my head, which we've done since then. But starting this, that's something like from the jump that any organization, that's what I would recommend, is leaning on programs that have done it like ours, and going through and I wish I would have done that too, like reach out to other programs that are doing similar work to figure out like what I could have done differently early on to make it as seamless as possible, not just for our organization, but for the participants that we were serving within our program. Hopefully that answers that question.
Well, thank you very much, Ariel. I think we also had a question about what the difference between trauma-informed care and harm reduction was. And I think people answered in the chat, then it's like harm reduction is trauma-informed care. I think the necessity of calling harm reduction and not just like an extension of trauma-informed care is because people who purport to be trauma-informed and to engage in trauma-informed approaches will still not engage in harm reduction and still think that that respect of agency is awarded in domestic violence situations, but suddenly if they're telling you that they're shooting up, that for some reason goes out the window. Is like, leave when you're ready, but definitely get sober right now. Like, what are you talking about? Like, I'm never going to tell you that you have to leave your abuser, because I understand that's something you have to do when you're ready, and it's one of the most dangerous things you can do. But even though you could say the exact same thing for any kind of drug use. Like, I should never tell you to stop using any kind of drugs, because, like, hey, maybe you depend on your abuser so that your children are housed, and so that you're housed, and so that you have a car, and et cetera, et cetera. Maybe you depend on your drug use to, like, stay afloat, stay alive. And just like it's super dangerous to leave an abuser, it's super dangerous to just stop using a drug. So the distinction is necessary because of the things that surround it. But harm reduction is a trauma-informed approach. And I shoot it back to the panelists if anyone has anything else to add to that distinction.
I was
So
gonna say, oh,
go,
ahead.
Heather. Go ahead.
Oh, I was gonna say, like, it's none of our business. Like, it's just, it's people get to make whatever choices they want, and they get to have services either way. I mean, really, it's just like about that.
So I have an interesting stance. I think what informed means is that you've been told about something and you know it exists. So trauma informed, that's like, is it an internal crisis, an external crisis? Was it a physical assault or a blown tire? Healing centered is where I'm moving. So, like, just knowing about trauma isn't enough. Am I acting in a way that is kind and healing and compassionate, that someone will feel liked? We can't. So in our work, we serve about 600 people a month, continuously, and sometimes for years. We don't have exit dates in our program. We think that you'll drink while you're thirsty and not when you don't want to. When we create community, so when we think of trauma informed, I think more of healing centered, because I know bad things happen, but it's our behavior that matters. And we can't help everyone. I can't pull housing out of under a hat. I can't pull a lot of safety out from under a hat, but I can make someone feel appreciated or unappreciated. I can make them feel liked or disliked, respected or disrespected. And I can tell you that no matter whether I can help them or not, what I hope they feel when they've been with me is that they were liked, that they were respected, that we saw their creativity and their intelligence and their whole being, of every part they wanted to show to us. Because healing centered is the way we act. Trauma informed is knowing. And then what do we do about it? That is the healing centeredness. So a good measuring stick for me when I'm starting to want to police someone else's life. And that can happen, especially if I care a whole bunch. If I start to get real attached, I will start talking to them like they're my own child. And one time I told my own child, she said, "You're not listening to me." And I said, "I don't want to listen to you. I want you to go to your room and tell this pandemic is over." And people said, "What did she say?" And I said, "Well, she called me a bitch and hung up," because she lives in her own apartment and she is an adult. And and I expect the clients to say that to me too. Like, and hang up on me if I'm gonna treat them like children and try and parent them and care too much when it's their life. So I have to check myself. Am I being healing centered? Am I being kind? Am I being compassionate? Because that, at the end of the day, if I can't do anything else, that is the bare essentials. That I don't create learned hopelessness and helplessness just because I was a shitty human being that didn't have compassion, or I loved too deeply and I couldn't keep my mouth shut. So that's my little perspective on trauma informed.
Thank you so much, Lisa. And I see a really interesting and cool conversation happening in the chat that I think I would love to bring to the panel around harm reduction, just like as a tool in general, And I will read the comment. I would love to kind of have a more broader discussion on kind of like the very lofty harm reduction ideals, which I think kind of helps get us all on the same page. So the comment reads, I am for harm reduction. It seems like harm reduction is making its way as a tool that focuses on the safety of individuals suffering from chemical dependency. One thing I want to say really quickly, just before I keep going, is that chemical dependency can be one of the things that happens around drug use, but it is not necessarily what harm reduction focuses on specifically. But moving on, how do you handle pushback from others that feel it normalizes drug use or even promotes this? I've been approached with this concern before, and then some, like the substance use disorders were compared to, you know, things like diabetes and stuff like that in the comments in the chat, which I think are all really good points. But something else I want to bring to the conversation as well is that treating drug use exclusively as a medical condition has served us in the past in ways that make us legitimize like the services we provide, but it doesn't necessarily address what harm reduction is as a whole. And would love to just continue that conversation with our panelists in terms of that, like how do we address that like whole like harm reduction just promotes or normalizes drug use?
I think one of the, I mean, we have this conversation as harm reductionist almost every day, right? Especially like being a harm reductionist, operating an SSP in a very rural, conservative community. And the biggest thing that I always discuss is that harm reduction at our core, what we try to be for the individuals that we're serving is the connection. It at the end of the day, regardless of where they're at in their spectrum of their recovery path, we are there for them through all the good, the bad, the ugly, the great, the beautiful, everything. Like at the end of the day, we're that connection that they know is going to be there with an open heart, open ear, and a wide open shoulder for them whenever they need it. And I'd love to see like Heather, like what you have to say, just like from the nitty gritty of it all.
Yeah, thank you. The bottom line is that like people aren't like breaking down the door to serve people who use drugs. Like most people do not give. They don't care, right, about this community. And it's just really simple. When people are accessing services, they access other services because they are hopefully treated with like respect, and someone is telling them that they care, they're in their corner, and it's just what ends up happening. More people, you know, and not that this is the goal, because getting into treatment is not the goal. And if that's your personal goal, you better like put that like, you know, I mean, you know, you just have to like put your force field up and not be, I don't know, like, yeah, it's hard to see somebody suffering, but it's not about your agenda. But more people do go into treatment when they're like accessing services at SSPs. It's just true. It's just what happens. So I don't know. And I think, yeah, it's just, yeah, I'm sorry. I hope that makes sense, but.
Well, I always wonder, when people ask me that kind of stuff, I can ask sometimes, what is your job description? Like, wow, that's really interesting. Because I'm wanting to know if anywhere in their job description it says make people stop using drugs. And it doesn't. I've never seen a job description with that in there. Not one of them. Not even at the hospital, right? That's just no one's job. So when we start to step out of our lane and start to determine what's good for other people, I also like to ask, like, so are we asking about tough love? Do we just take away access to good things and hope that someone heals themselves? Because if that's the case, then we should all just quit our jobs right now and go home, because everyone can just go heal themselves and we're no longer needed. I like to unpack things like, are we being abusive? Like when we say, well, maybe they're not ready for this job. Well, I think they will determine that in the application process, in the whatever. To have these judgments, are we being abusive? Are we taking away good things? And anytime we take away good things, I don't understand how that can help. Do you? How is that going to help? And I just start asking questions, I used to get real mad and slam the table and stomp out. I don't recommend that. I don't recommend that. I recommend asking questions. And if you need to take a break, be like, you're really hurting me right now. This ouches, and I need to take a break. Let people know that they're hurting you, that what they're saying is harmful now, not just when they get to the clients. And that has been helpful to me. But then there's still some people that I'm side-eyeing all the time and just hoping that we can educate or educate, like however it happens.
I saw this in the chat too, and it's something that's been helpful for me in the past, is like highlighting what they're doing that is a harm reduction technique in their normal life. I always mention coffee and the hand keeper from getting hot thing, because that's using harm reduction while consuming a substance. So like using those types of tools is a really good one for me. And especially when we start to like talk about harms of substances, I always like to bring up, which I'm not gonna demoralize or like, I don't like to compare substances at all, but like we don't condemn the mom who drinks a glass of wine at the end of the night, and alcohol still continues to be one of the more harmful substances in our communities statistically overall, right? And that's something legal that we don't like point fingers and take kids away.
Oh, these are all great points. And also in the DV perspective, we're always saying that we want to increase options for survivors. Harm reduction increases options for survivors. If your only options are go completely cold turkey to get access to a lottery basically for resources, because it's never guaranteed you're going to get housing, because as Lisa said, they ain't none. They ain't got it. We ain't got no housing on us right now. So it's always a lottery to get into these things anyways. So you're just suffering, hopefully, that if you suffer enough, someone's going to give you something. It's very Catholic. It's very upsetting. But and also, of course, folks assume that they can't get support if you don't tell them that you would support them in these contexts. You know what I mean? Like if you don't say that you have a harm reduction stuff, or like if you use substances, it's okay to be here, you're going to just have a lot of people who just assume you're not going to be that person. And why would they put themselves through a more traumatic experience? Because being told no when you need something that badly is a traumatic experience. It shuts someone's down. It changes how they are with people in general. It makes them close doors that they may never open again because especially as everyone's saying here, they might pass like that. So like just being like, this is at least at the very least, it's just a saying that I will support you no matter where you are in life, not even your journey, because harm reduction is not a journey to sobriety either. As we said in the very beginning, drug use is a social activity. Not everyone does it, but anyone can do it. It's happened since the dawn of time, and it happened before the war on drugs. Drug use happens. So I think people are talking about how they talk to people about it. And I say basically political statements that I am not against drug use. I think it's a social activity, and I think it's a normal thing to do, and we do it all the time. And there are times that you did it, and if you lost your housing after that one time you like smoked weed at a party once in college, would that have helped you? No, probably not. It would not have been ideal. If you got kicked out of your housing, if you lost your job immediately after you took a Xanax from a friend before a big presentation or something, and you just lost your kids and your entire life, how would that have been useful to you? So I'm like, obviously using drugs cannot be, and it depends also in the space you're in. If you're in a space where people are like, housing is a human right, all these things are human rights, I'm like, that means they're inalienable. You can't take them away. They are a right. Why would using drugs mean you no longer need your basic things to survive? And when we get into that space where services like are closed because you use a substance at some point, we're not going to get into the amount of surveillance that requires, and how like people who have money but use drugs do not get that much surveillance into their worlds or into their lives, and never lose anything from drug use, and also can go to really nice rehabs, very nice rehabs, like really beautiful places. to recover and heal. To Lisa's point, they have that healing apparatus where it's like, yeah, maybe you need to get in touch with nature for a little bit and some time alone and some space away from certain things. People without money don't get access to that stuff. They are basically sent in jail or like shame jail and be like, we hate you. You shouldn't have housing. You shouldn't be able to have your kids or be around a community. You shouldn't have any love or support in your life. How does that help anybody? I just don't get it. I'm like, I've never understood how you could dislike substances to that degree. When someone might just be taking a little Coke to go to work because they're tired and they can't lose this job, or they're like, I'm in pain because I don't get workman's comp and I got hurt 20 years ago or something like that's. There's just so many reasons to use substances, and there's no real reason, in my opinion, to believe in a world where everyone is sober all of the time. I just don't get it at its premise. Like, I think that even answering that question, like, kindly and taking that premise on, I'm like, I think it's doing them a disservice. I'm like, really think about what you're saying here. That's insane. Do you hear how that doesn't make any sense? And of course, most people you talk to do have used some substance in the past or use substances currently, but they're, in ways that they don't think are bad. Because, like, again, I went to Catholic school, so I went to private school as a child. All those kids were passing around all of our parents' drugs. What the fuck? That's like the first time I used drugs ever. Was someone offered me their mom's Xanax. That's why I brought that up. Like, that was back in the day when they had Valium. Remember Valium? No one has Valium anymore. So, like, those lovely old school drugs too, where you're getting something that's like, oh my gosh, it's very 50s, very Mad Men, very like Stepford Wives drugs. Like, oh God, I think I actually knew somebody who had, like, their parents still had Quaaludes. Do you remember Quaaludes?
I do.
Yeah. I was like, how did
you make your people? I do. I was in this training once with public mental health, and they were doing a mental health first aid training, and they said a comparison. So what about substance use and drugs? And the students at UT could take a whole bunch of bars all weekend, and that is just college. But our clients who have a beer while they're homeless with their SSI check, they might need rehab. And the client who they were talking about later said to the caseworker who had asked, like, I can't even afford an addiction. What are you talking about? What did you do this weekend? And I know what the caseworker did, and it was not legal, because I heard the conversation about the ping pong balls being torn apart and laid exactly across all night long. That is not alcohol. That's not weed. That's something else, right? But they had a lot of judgment on the person who'd been homeless for 2 years that had gone through 15 or 20 caseworkers who'd never finished any paperwork. And therefore, this person is now chronically, endlessly homeless with the staff turnover at that agency. And yet, when they're talking about the college students who were strung out on Xanax, doing rape parties all weekend, that was fine. That's just a college experience. We don't really know if they have an addiction problem. We won't know till later. Like, the amount of forgiveness for people with money just in that training, and the lack of compassion for some guy having a beer. Like, he's cooking outside and having a beer with his friends. I want something good for you. I'm glad you had something good. Homelessness is no fun. I did not like it at all.
Also, we can't even afford to have this conversation because the proliferation of fentanyl analogs in the drug supply, like LA County Department of Health is asking programs to hand out glass to smoke fentanyl because it's safer than injecting fentanyl. Like that's how bad shit is, right? So, yeah, everybody is impacted by this, and with how risky it is, just because of this unregulated drug supply, it just seems like we have to shut that whole conversation down. And like it's been said before, everybody uses drugs. Hello. So like, yeah, get real about that. Not everybody, but almost.
Thank you so much, y'all. I have a quick question from Chibundo from the chat. Someone just wanted to know, like, how big the SSP in DC, so HIPS, is.
Okay, so there's 2 sites, I think, right now, and I think there's 36 staff there last time. I don't work there anymore, so 36 staff there last time I was there. I don't have the numbers on how many people that are served, but there's 2 drop-ins and there's the mobile van. I think we have 2 vans, or they had 2 vans, excuse me, when I was last there. So yeah, there's that.
Thank you very much. And we are unfortunately almost at time. I have a time for a few more questions. One that I really do want to ask, because it's kind of like the whole point of why we're holding spaces like these, is what can relationships between domestic violence agencies and harm reduction agencies like SSPs look like? And what partnerships have y'all been able to build or have seen be successful? And what partnerships have been easier to build, which have been more challenging, and why, etc.?
I think we can educate another, right? Like, it is so much easier for me to go to programs and do harm reduction 101 trainings and stuff, instead of assuming that I can do all the things, because we have such limited, restricted funding. And I want to keep my attention specifically on people who are using substances, but I also want domestic violence agencies, who often get significantly more funding, to provide these services to our participants, to do so in a way where I don't feel like crap referring my participant to them. So I think that's a huge way. And in the same realm, I think that domestic violence, like helping us identify like some of those red flags. Like, I've worked in a domestic violence agency before. I did the opposite of Chibundo, where I started in a domestic violence program and I transitioned into harm reduction. So when I came into harm reduction, I was able to notice when the girl was sitting real stiff next to the dude and being like, oh, I'm going to pull that person aside, or recognizing the value of keeping, like, instead of bringing the couple in together, especially when the dude's really like persistent and like, no, she was with me, she's with me, being like, no, we do this separately. Like, you both deserve a private space, and holding them separate. And I think those are the types of, I think it's really important for harm reductionists to understand the power and control wheel and understand how that's used, so we can educate our participants. Because harm reduction is reducing harms in all aspects of life, not just in our substances.
Well, we have another question that I think is really interesting, and that I know is often discussed in DV spaces, on how do you give resources and support to people who themselves are the abusers? How do you engage in harm reduction with people who are maybe perpetrating abuse?
I think most harm reduction agencies, we already do that. Like, I will say that's one thing we definitely got down. You're going to be serving folks who are going to be violent. Especially when I was working with sex workers, we're going to be giving supplies to people who are literally pimping people out. Like, you see the girl in the corner, dude's coming up, you're going to give him his magnums. Because why wouldn't you? As I think everyone has said here, but whatever things you're doing in your life, there's no reason for us to punish people by making sure that they can't have resources, even when it comes to violence and harm. We say that with drug use, that like, if sobriety is somebody's goal, making it so that every time that they continue using isn't disastrous and turns them into a spiral, that sounds ideal, right? You want them to keep being alive to one day choose that, if that's what you want somebody to do. I think it's the same thing with harm and violence. If someone's doing violence, it's like, okay, you give them the services they need, and you give the person the services, give the survivor that oh my God, what term would you use about this? I'm trying to be like not too aggressive here. But the survivor that's in their lives, be like, I don't think in most like cases, making the person who's doing abuse feel more like, I don't know, like judged, or making it feel like, if they come here that you're going to take them away from them or any of that stuff, it never makes it easier for the survivor, So I'm like, just always keep the survivor in mind, that that person is expressing abuse on. And also, I still very much believe that even if you are a violent person, you still deserve housing. You still can change. We've all, at least, I don't know, in harm reduction, we've all done things we haven't been proud of. But, we've all lived experience. We've all done some things that, We've all done some things. And we all know that you can be better in the future. You can do better. So I think that in DV spaces, that feeling doesn't come up as much for obvious reasons, because that's not where you need to be. You're here just for the survivor. Generally, I will say most DV programs are not yet at the space where they're doing prevention work, doing like the educatory work with people who cause harm. So yeah, that's gonna be my answer. Other folks have better things to say. I was gonna go, yeah, that one. Okay, so someone just said in the chat that the binary between a survivor and abuser doesn't necessarily exist either. That is so freaking true. It is so freaking true. And I think in harm reduction, you see that where someone's surviving violence from somebody, but also causing harm to somebody else, or like, flip flop. There's a lot of musical chairs going on. So these are just also harmful behaviors that people are doing. And we do our best to address them where they're at.
Well, thank you so much. Is there anything else the panelists, would want to leave this audience with, since we are coming up on time?
I think one thing is just be there, wherever they're at, be there. And then just continue to ask questions, continue to hold that open link between both like DV, harm reduction, because I do think that there's such a huge opportunity. I like all of our mission, right? Like we want to see nobody else pass away from an overdose in the same capacity that you guys don't want to see. Like you want to see the end of domestic violence. And I think we could get somewhere close to that if we work together.
I just want to thank Juana and Alika again and NASTAD for championing this topic. It's really important and it's so under discussed. So thank you. And again, thanks to all of my fellow speakers on this panel. Y'all are so amazing and inspirational.
Yes, thank you all so much. I am not as eloquent. So what I'm going to say is please don't leave me. We have jobs available. Start applying for jobs in domestic violence and sexual assault resource centers. You're wanted, you're needed. These intersections are needed, and we can work together to create a better world. I think it'll be better if we do it together.
I completely agree. And I think the last thing I'll say is like in DV and harm reduction, just think of which violences and harms are we okay with? In harm reduction spaces, some people might be a little less upset about violence that someone's experiencing in the space or in the community. And in domestic violence spaces, we might not see us separating somebody from the things that they use to stay safe and to stay secure and stable as violence. There's a lot of harms and violences that we do in these spaces that we don't clock as such because of the community and the culture in the space. And just, constantly interrogate yourself and your work about who is not being served here, who's being left out, what can we do to stop that? Back to what Lisa saying was before, who keeps getting turned away and where do they go afterwards? I think figuring out where do they go next will make you a better harm reductionist and a better domestic violence advocate.
Thank you so much to all of you. If anyone has any questions for any of us, whether it be NASTAD or the panel or ORN, we have our contact info up here, and this will be shared with you when the slides are shared as well. So if you don't have time to write down all these emails right at this moment, don't worry about it. We will be sending them to you. And can you go on to the next slide, please, Lika? And if you have some time right now and your phone's next to you, maybe you want to pull out that phone, scan that QR code, and tell the people that give us the money to pay panelists that are as awesome as this, how awesome of a job we did. So they'll give us more money to give the panelists more money also. That would be awesome. No, but actually, it's very useful to know how people appreciate or are able to use the information we share. Oh no, I will share the link in the chat if the QR code isn't working. Thank you for letting me know.
Well, and as we said back in my old Quaalude days, right on. So thank you.
Thank you. Okay, I'm putting the link in the chat just now. And we have been considering turning this topic into something where we can maybe explore it more consistently, maybe have some kind of call, some kind of peer-to-peer call. We haven't decided whether it's something we want to do necessarily yet, but another survey will eventually pop up as you exit the Zoom call. Or I think it's a poll that we have to activate actually. So that you can let us know if that's something you would want and what way you would want it. So if you're interested in having more of these conversations and building relationships with the people that were on this call today, please let us know how you would want that to happen.
Yeah, it should pop up right after we close out. And if for some reason it doesn't work, we will include it in our follow-up email and can always reach out to us if you have any thoughts, considerations.
Well, once again, thank everyone so much. And I think this is where we end our webinar.
Thank you all.
Thank you.